Hi, hello friends, welcome to World Explorer India. As a part of patient safety series, today let us discuss about sign in, sign out and timeout in operation theatre. In the previous videos I have discussed already in detail about what is timeout. For a quick review, let us see what is timeout. Timeout is confirming all the members have introduced themselves by the name and role, and also ensuring the right patient and right procedure of the surgery and right site of surgery is being verbally confirmed by surgeon, anesthesia and the team, and also surgeon reviews if there is any critical steps or if operation duration or anticipated blood loss. All these things will be anticipated, critical events will be identified in the timeout, and also if there is any specific reviews related to sterility maintenance or whether has antibiotic prophylaxis has been given or not, whether patient is having NPO or not, or the essential imaging has been displayed in the operating room, and also all the details of the patient is getting tallied from the imaging, patient, verbal consent, and also the file of the patient, etc., and also the patient band and marking, etc. So this is just to ensure the right procedure of surgery is going on for the patient. That is called as timeout policy. And today let us see what is sign in and sign out. Sign in usually done before the induction of anesthesia, usually done by the anesthetician, where the anesthetician will identify the patient by his name and his hospital record number, and also whether patient will be identified by his diagnosis and site of surgery, and whether consent has been taken or not, and if the site is marked or not, if the site is marked, whether is it marked in right manner or not, and also anesthesia safety check also will be being completed by the anesthetician, and also they will assess the initial parameters of the patient such as pulse oximeter, how much SpO2 the patient is being maintained, what are the blood pressure, etc., whether patient can go for the induction of anesthesia or not. Apart from this, they also will check out for if there is any allergy for the patient, or whether patient may need any additional consideration. For example, if patient is having a cardiovascular risk, so whether they need any extra precautions, or sometimes there is a difficulty intubation. So if there is some difficulty intubation, whether they may need some of the advanced equipment where such as endoscopic intubation, they may do endoscopic intubation. And also the anesthetician will identify if there is a risk of blood loss, that is heavy blood loss, if that is greater than more than 500 ml blood loss, or if it is approximately 7 ml per kg in children, then anesthetician will ask the staff or the patient and relatives whether the blood has been arranged or not. So these are all the things which is being done in sign in. So in short, sign in is done before the induction of anesthesia, and the topic which we have discussed already, that is timeout, is done before the skin initiation, and the last topic is the sign out. Sign out is usually done before patient leaving the operating room, but here nurse will verbally confirms that the procedure has been recorded or not, the instruments, sponges, needle counts are correct, and whether the specimen which is being collected during the operation has been labeled in a proper manner, and also will read out loud so that label has been correctly applied on the patient specimen, and also whether if there is any problems has been arised, whether these things should be addressed. These all things will be discussed in the sign out. Once all the instrument, sponge, needle counts are correct, and once the nurse is going to give verbal confirmation, then only the surgeon, anesthesia professional will leave the operating room. So for a quick review, sign in is done before the induction of anesthesia, timeout is done before the skin incision, sign out is done before patient leaving the operating room. If we are able to follow these 3 steps in a professional manner, majority of the mishappenings can be avoided, and also patient safety can be enhanced in the operating rooms. Do like this, subscribe and comment. Thank you.